I'm Natalie, and I'm 3.
Natalie's had a long journey. She actually came to see us for the first time on her 3rd birthday, and we discovered that she had this problem with her hip being dislocated from when she was born.
Dr. Hooker needed to explain what hip dysplasia really meant. She was young enough, we caught her early enough that we could have surgery.
I didn't even feel it because I was going to sleep.
She actually remembers very little about the hospital experience as much as her visits here. She gets excited to come. She loves the MRI team.
Natalie was amazing from the beginning. You see on your schedule the day before, you see, okay, we have a 3-year-old coming in and she's gonna do this without sedation. That's rather unheard of, but we'll always give it a try.
I get toys and not move.
If you don't move, if you're a statue.
Like this. That's how a statue.
The movies are the most amazing thing that we could ever ask for as MRI techs. The amount of sedations that we've had to do since we received the MRI goggles has drastically declined. You know, you don't want to have to sedate a child if you don't have to.
They helped us to realize that this would be just a journey and that we were going to be there on the other end, and they were going to be with us throughout this period.
I can do lots of moves.
We have more expertise in terms of knowing what the tolerances are. A lot of times when you see somebody who isn't familiar with taking care of children, they may think of surgical options or more aggressive treatments that would be necessary in an adult. And in children, a lot of times, you don't have to be that aggressive or that wild and crazy. You can be a little bit more child-friendly.
We were able to care for Natalie and not have to worry about the bigger picture. We were confident in the team that was in place.
When you go through this, you just go, gosh, I really miss seeing that. And will I ever, it feels like she's been in this cast forever. Will we get through this? Or this day has been really tough. And, all of a sudden then you have a community come and surround you, and you have the spirit of this little girl that's the one who's actually going through it all. And it's amazing to see her handle it with grace and strength and come out just this wonderful child.
It's fun to walk around.